Now let us start with our pleura and lungs. So first let us see the serous sac. So the serous sac of the pleura have the visceral layer and also the parietal layer. So you can see this is the parietal pleura and this is the visceral pleura. Visceral pleura is actually intact with our lungs and the parietal pleura is the outer covering. So we know same like the pericardial cavity as we read in the part 1. So this is a part 2 video. So you can see as we are read there. So the pleural cavity is nothing but contains a serous fluid. It is between the visceral pleura and the parietal pleura. Now you can see the visceral pleura is made up of the splanchnopodic layer of lateral mesoderm, that is nothing but the innermost layer of the lateral mesoderm, and the parietal pleura is made up of the parietal layer of the lateral mesoderm. So the parietal pleura is actually divided into furthermore subtypes according to the location, like coastal pleura, cervical pleura, means in which area it is located. According to that, it has different locations. So cervical pleura covers apex of the lung. So you can see this is for example, you can see this is the apex of the lung and it is covered by the cervical pleura. It is called as pleural cupula. So in the lung diagram here you can check it out. So cervical pleura is covering this part apex and it is called as cupula of the lung. So now where we are. So cervical pleura covers the apex of the lung. And next coming to the Sibon's fascia. So Sibon's fascia is nothing but the degenerative part of the scalenus medius and contains the scalenus minimus. And it is nothing but Sibon's fascia is nothing but the suprapleural membrane. So the suprapleural membrane is also known as Sibon's fascia. So you can see this is the Sibon's fascia. It starts from the C7 vertebra and ends at the inner border of the first rib. And you can see this is the suprapleural membrane, also known as Sibon's fascia. Upon the apex of the lung, you can see this Sibon's fascia starting from C7 vertebra and ends at the inner border of first rib. So the structures passing above these are the subclavian artery and the subclavian vein, as you can see here. So now let us see the costo-mediastinal line of reflection. Usually it is a line diagram. Let us know how it is started. So this is a sternoclavicular joint. This is the right sternoclavicular joint and this is the left sternoclavicular joint. So first let us start with the right sternoclavicular joint, right side. Let us first we need to draw a straight line up to the 6th rib, and next from 6th rib it continues like this, and at the 7th costal cartilage we have the schiphosternal joint, and next at the 8th we have 8th rib we have the mid-clavicular line, and the 10th rib we have the mid-axillary line, and at the 12th rib we have the T12 vertebra. So this is the order of the right side. And at the T12 rib we have 10, and at T12 we have 10th rib, and at the mid-axillary line we have 8th rib, and here we have the 6th rib. So the space between this 6th rib and this costo-mediastinal line of reflection, the space between these both is known as costo-diaphragmatic recess. That is nothing but above this the lung is present actually. So the space between the lung and this costo-mediastinal, this reflection line, this is known as costo-diaphragmatic recess. And here you can see on left side we have up to 4th costal cartilage we need to draw, and 2 to 2.5 millimeter gap we need to give it like a this is known as costo uh, mediastinal recess, and this is called as costo-diaphragmatic recess. And from the 6th costal cartilage, same like this we need to continue. At the 8th rib we have at the mid-clavicular line, 10th rib at mid-axillary line, and 12th rib at T12 location. So this thing is same. So here we have the mediastinal recess and we have the costo-diaphragmatic recess. Let us see this. So we have two recesses. The costo-diaphragmatic recess is the most dependent recess, and the costo-mediastinal recess is the anterior margin of the lung, falls short of the costo-mediastinal line of reflection, and the position and the extent is highly variable of this mediastinal recess. Now let us understand the nerve supply. So lung is supplied by which nerves? Let us understand. So the intercostal nerve is the peripheral part of the diaphragmatic pleura and costal pleura. So intercostal nerve mainly supplies the peripheral part of diaphragmatic pleura, that is the costal pleura. And the phrenic nerve supplies the central part of the diaphragmatic pleura, that is the mediastinal pleura. And the left lung, in a high lung, so we'll check those images here. So lungs we have here the medial view. So this is the left lung, right? So in the left lung, in the high lung, we have the structures are arranged as follows, like in the order from above downwards is pulmonary artery, hypatrial bronchus and left pulmonary vein. So we can remember it by a mnemonic like ABV. ABV, that is pulmonary artery above. Next we have hypatrial bronchus and next we have left pulmonary vein. So left pulmonary veins is the lowermost one. So next let us see the in front of hilum, that is in front of hilum. So this is hilum, right? In front of it what we have? So in front of our hilum we have the cardiac surface, right? Because it is left side of the pleura, that is something about left lung. So we have our cardiac surface, right? So we have our left auricle and also anterior lateral surface of left ventricle and also lingula. So remember lingula is only present in our, so this is the lingula. So this lingula is only present in our left lung but not in right lung. Right lung doesn't have lingula, only lingula is present in the left lung because of this cardiac notch. Here like small structure is formed. This is known as lingula. So lingula is not a lobe, right? It is an extension of the lower end of the cardiac notch. And next, above the hilum. So this is the hilum. So above the hilum, this area. So above the hilum there is arch of aorta. So you can see this is the impression of the arch of aorta. And we also have behind the hilum descending thoracic aorta. So behind the hilum we have the, so you can see this is a groove for arch of aorta and behind we have thoracic duct, right? And next so you can see this is the groove for descending aorta, that is behind the hilum. So above the hilum we have arch of aorta, descending below, behind it we have descending aorta. And the nerves are anterior, the nerves passing anterior to the hilum are the phrenic nerve and also pericardiophenic vessels. And faint left brachio, and the faint side we have the left brachiocephalic vein, and behind the hilum we have our vagus nerve, and above the arch of aorta we have the left subclavian artery, and beside this left subclavian artery we have our esophagus. So you can see this is the area for trachea and esophagus, and this is the oblique fissure, and this is the arch of aorta, and this is the pleura cuttage. This is the left pulmonary artery, and the left bronchial arteries, and the left main bronchus, and left superior pulmonary veins, and we can also see bronchopulmonary hilar lymph nodes, and the inferior lobe. This is the inferior lobe and the left inferior pulmonary vein, groove for descending aorta and also inferior border. And here we can see this is the apex. This is a groove for subclavian artery, right, and a groove for brachiocephalic vein, and a groove for an area for the thymus and also fatty tissue. And this is a superior lobe, right? So this is a hiluminoid, and this is a cardiac impression, and this is a pulmonary ligament. This is a cardiac notch, oblique fissure, and also groove for the esophagus. Here. And also the diaphragmatic surface, of course, and also the lingula. Now let us check out about the right lung. So right lung also have hilum, right? So that is a right lung's hilum, and it has a epicardial bronchus, pulmonary artery, and also hypatrial bronchus, and also lower pulmonary vein. So above downwards arrangement. This is a above downwards arrangement in the hilum. And in front of the hilum we have the cardiac surface again, that is containing the right, because it's right side, it has right auricle, anterior lateral surface of the right atrium and the right ventricle, and the cardiac surface mainly it is posterior inferiorly, it has the inferior vena cava. And above the hilum we have the arch of esophagus, trachea, and behind the hilum we have our esophagus. So in front and above we have a right brachiocephalic vein and also superior vena cava, and behind the superior vena cava we have a trachea. So nerves are in front of the hilum. The nerves are right phrenic nerve, pericardiophenic vessels, that is right side. And behind the hilum we have the right vagus, and on the right phrenic nerve passes through in IVC orifice, that is inferior vena cava orifice. So let us see the right lung structures, and next are the blood supply of the lung. So you can see this is the right lung, right? So here is the apex of the lung, and this is the area for the trachea, that is you can see above the hilum, and this is the area for the esophagus beside this area of trachea, and there is also groove for azygos, right, azygos vein, and this is oblique fissure, and this is the pleura cuttage, right, and the right superior lobe epicardial bronchus. So right, this is the epicardial bronchus, and the right pulmonary arteries you can see, and the right bronchial artery also, and we have the right intermediate bronchus and the right superior pulmonary veins, bronchopulmonary hilar lymph nodes, and the right inferior pulmonary veins. And the groove for the esophagus is here, and also we have the pulmonary ligament and also inferior polar. And this side you can see the groove for the subclavian artery, and the groove for the brachiocephalic vein, and the groove for the first rib, groove for the superior vena cava, and also area of thymus and also fatty tissue of the anterior mediastinum and the anterior border, hilum, horizontal fissure, cardiac impression, oblique fissure, middle lobe, and groove for inferior vena cava and the diaphragmatic. So this is groove for inferior vena cava and also diaphragmatic surface. So as we have studied here, so you can just recall all the structures. Now let us see the blood supply of the lung. So up to the respiratory bronchiole, it is by so where to show the respiratory bronchiole? So yeah, again here you can see. So we have respiratory bronchiole. Up to the respiratory bronchiole, the blood supply is mainly by the bronchial artery. So the bronchial artery is divided into right bronchial artery and the left bronchial artery. The left bronchial artery has a double, that is it's 2, and it's derived from the descending thoracic aorta. But the right bronchial artery is only one, single, and it is derived from the right third posterior intercostal artery. So in these pictures we can find this is the right bronchial artery here, and this is you can see superior left bronchial artery. So bronchial artery only supplies up to the respiratory bronchiole as we discussed here. So left bronchial artery is 2, right, derived from the descending thoracic aorta. So you can see the superior left bronchial artery and inferior left bronchial artery, right, 2, but our right side is only 1. So you can see right bronchial artery only 1 branch. It doesn't have 2, it is 2, but left side is 2. So now here let us check out the respiratory bronchiole and beyond. So up to respiratory bronchiole we have our bronchial artery, but later part is supplied by our pulmonary artery. So pulmonary artery will also supply. And what is Rasmussen's aneurysm? It is nothing but a pseudoaneurysm that results from the weakening of the pulmonary arterial wall by adjacent cavitary TB. So in the TB conditions we see this respiratory aneurysm, that is the pulmonary artery wall is damaged. And the bronchopulmonary segment, so that is in the short form known as BPS, so that is nothing but a segment aerated by the tertiary bronchus mainly, so surgically resectable segment, and it is wedge shaped. So here first let us understand the bronchial reach. So first T4 is greater than T6 for the tracheal bifurcation, right? So trachea is divided into right bronchus and the left bronchus. This is the primary bronchus. So the primary bronchus is furthermore divided into more vertical line. Yeah, right bronchus is more vertical line with the trachea, so aspiration pneumonia or whatever the foreign particles easily enter towards the right side when compared with the left side, because right side is more broader and also more vertical line with the trachea. And next, so the first primary bronchus is again further divided into secondary bronchus, and the secondary bronchus is divided into the lobar branches, and the lobar bronchus is divided into tertiary segmented bronchus, and this tertiary segmented bronchus nothing but gives rise to BPS, that is bronchopulmonary segment. So each bronchopulmonary segment is intrasegmental, that is tertiary bronchus, and also bronchial artery and also pulmonary artery. So all these are present in the intrasegmental part, and the intersegmental is mainly by the pulmonary vein supplies the intersegmental, that is the areolar sector between the BPS, that is bronchopulmonary segment, derived from pulmonary pleura. And next, let us compare between the right lung and the left lung. So you can see the bronchopulmonary segments in our right lung and the left lung. So right lung, first upper lobe we have the apical and the anterior, right? Apical and anterior, and also of course posterior. So in the apical we have 3 parts, that is apical, posterior and anterior. And next in the middle lobe we have medial and lateral, right? So you can see this is the medial and this is the lateral. And in the inferior lobe we have our inferior or lower lobe we have our apical, anterior basal, posterior basal, medial basal, and also lateral basal, right? So in the inferior lobe we can see this is superior, anterior basal, lateral basal, so right. So the total we have in the right lung we have 10 segments in total, and in the left lung, coming to the left lung, we have upper lobe we have our apical and also anterior, posterior, same like our right lung, and in superior inferior corresponds to the middle lobe of right lung, and nothing but superior lingual and inferior lingual. This is the only difference in our middle lobe, and the lower lobe also has you can see the apical part and anterior basal, posterior basal, lateral basal, medial basal. So right, same like a right lung, but the only difference in the left lung is here is the lingular part. So even here we have 10 segments, but the medial basal is not well developed in our lower lobe. So you can see the medial basal is not well developed in our lower lobe in our left lung. So the left medial border segment is not well developed in a left lung. And next, sometimes the anterior basal and the medial basal segments of the left lung fuse to form the anterior medial basal segment, that is 9 segments in this case. So sometimes apical and posterior segments of the upper lobe of the left lung also fuse, there is a apico-posterior segments and giving rise to only 8 segments. So the segments in the left lung, we can, in the options according to this we need to answer, that is 10 is greater than 9 is greater than 8. Next coming to the applied anatomy of bronchopulmonary segment of lung. So dependent on the BPS on the standing position is the mnemonic SPB, that is a singer. So on standing, posterior basal segments of the lower lobe of the right lung is most dependent. And in dependent BPS in supine position is the apical segment of a lower lobe of the right lung. So by this we have completed the important points for pleura and lung. So from bits we need to know some important points regarding this. So we have one page important points from the bits. So what is the type of respiration? We have quiet respiration, deep inspiration and forced respiration. So inspiration rib elevators are what and the expiration rib depressors are what, let us see. So the quiet respiration, we have the diaphragm as a chief muscle and external intercostals, and the process is passive. And the deep inspiration, external intercostal, scalene, sternocleidomastoid, levator costarum, serratus posterior superior, innermost intercostal, and the expiration is passive. And in the forced respiration we have the levator scapulae, trapezius, rhomboides, pectoral muscles and also serratus anterior. And the expiration rib depressors are anterior abdominalis, internal intercostals, transverse thoracis and also we have the serratus posterior inferior. Now let us say latissimus dorsi and its accessory muscle of inspiration. It's accessory muscle necessary for expiration. Accessory muscles of inspiration are sternocleidomastoid, scalene, serratus posterior and anterior, erector spinae, pectoralis major and minor. And the breathing involves the changing the thoracic volume by altering the vertical, transverse and also anterior posterior dimensions of the thorax. So the diaphragm is a key muscle in respiration and the serratus posterior inferior is accessory muscle of expiration. So and the muscles of inspiration help increase the diameter of thoracic cavity by elevating the ribs. And the muscle of expiration help in the depression of ribs. So the mnemonic is sit Q depressors that work along with the anterior abdominalis for expiration. So that is sit Q. What is the sit Q muscle? Serratus posterior, inferior, internal intercostals, transverse thoracis and also quadratus lumborum. So the trachea starts at the level of inferior border of cricoid cartilage at the level of C6 vertebra, and the trachea bifurcates at T4 vertebra. It's 10 to 12 cm long, two parts, that is upper cervical and the thoracic in the superior mediastinum. Now let us see the surface marking for the lungs and the pleura. So level at the mid clavicular line we have 8th rib, mid axillary line we have 10th rib, and paravertebral line we have 12th rib. And the lower border of the lung, 2 ribs are higher, that is 6th rib, 8th ribs and 10th rib. For this 8th rib, 6th rib, 10th rib, 8th rib, 12th rib, 10th rib. So 2 ribs are higher. So we need to write it like that. And on either side we have the upper and lower lobes of the lung are separated by the oblique fissure. And this is marked by a line that runs anterior inferiorly from posterior end of 4th rib. And the spinous process of T3 vertebra crosses the 5th rib in the mid axillary line, continue inferiorly and crossing the either 6th intercostal or 7th rib on right and 5th rib or 5th intercostal space on left on both sides at mid-clavicular line. And left oblique fissure is located at the higher level and courses more vertically than a right oblique fissure. And next we have the pleura, innervation and the pain referred to. So the coastal and peripheral diaphragmatic pleura, that is innervated intercostal nerve, and the pain referred to mainly thoracic and abdominal wall. And the mediastinal and central and diaphragmatic pleura, innervation to the phrenic nerve C3, C4, C5, and pain is referred to the lateral neck and also supraclavicular region. And the structures related to the mediastinal surface and hilum of lung, right lung and left lung, let us see. So right lung anterior to hilum we have SVC, right brachiocephalic vein. Posterior to the groove we have azygous vein, behind the hilum and pulmonary ligament, esophagus, cardiac impression in the right auricle, right atrium and right ventricle. Posterior inferiorly we have IVC. And in the left lung, the cardiac impression, left ventricle and left auricle, right ventricle, and the large groove that arches over the hilum and descends behind the arch of the aorta and also descending aorta. And the arrow groove ascends the apex, that is left subclavian artery. Superior to aortic groove we have thoracic duct and esophagus. Anterior to subclavian groove we have left brachiocephalic vein. And the vagus nerve is posterior to the root of the lung and phrenic nerve is anterior to the root of the lung. and the roots of the lung are at the level of T5 to T7 vertebral bodies. Right lung has 3 lobes, superior, middle, inferior, and left lung only 2 lobes, that is superior and inferior. So the azygous vein may sometimes cause a more lateral position within 4 layered pleural septum within the superior lobe, creating an azygous lobe. This is not a true lobe. So, but a separated portion of the superior lobe lacks its own bronchi and arteries or veins. So, apico-posterior segment is left apical and posterior, and anterior-medial basal is left anterior and medial, and epiatrial bronchus supplies the right upper lobe, which includes apical, posterior, anterior part, and the principal bronchi is greater than lobar bronchi is greater than segmental bronchi. And the BPS is the largest subdivision of lobe named according to the segmental bronchus supplying it. So the right principal bronchus wider, shorter, more vertical than the left. Right inferior lobar bronchus continuation of the bronchus intermedius, which is continuation of the right principal bronchus. So the bronchial arteries are derived from descending thoracic aorta, left bronchus cross esophagus at 28 cm from upper incisor teeth, and 4 constriction junction of cricopharynx is 15 from incisor arch of aorta, 23 cm left bronchus 28, and the diaphragm 40. So this is just some important point from the bits. So we have completed a pleura and lung. So now let us start with the mediastinum and its contents. So you can see this is the mediastinum. Superiorly we have superiorly. So mediastinum is actually divided into the superior mediastinum and the inferior mediastinum, and there is an imaginary line between the sternal angle and body of the sternum. You can see at the level of T4 vertebra of thoracic vertebra. So it is divided into the superior mediastinum and the inferior mediastinum. So the superior mediastinum, above it has a superior thoracic aperture, so it is between the T1 and T4, and from T4 to T12 it is nothing but the inferior mediastinum. So inferior mediastinum is again divided into the anterior mediastinum, middle mediastinum, posterior mediastinum. So, and the lower part of that is at the T12 we have the diaphragm. So you can see the mediastinum in reality, in original picture. So first let us learn about the superior mediastinum. That is, here you can cut this superior mediastinum, the upper part one. So the superior mediastinum, anteriorly we have a manubrium, right, and posteriorly we have T1 to T4, and below we have up to T4 level. Up to the T4 level we have a superior mediastinum. And the mediastinum is a mobile septum between two pleural sacs. So you can imagine this is a side section. So here you have one lung and that side we have one lung. So it is between two pleural sacs and it is a mobile septum, right? So the imaginary line from the sternal angle to T5 to T4 divides the mediastinum into superior and inferior mediastinum, right? So what are the contents of the superior mediastinum? So the superior mediastinum contains a thymus that is present in the superior mediastinum but also extends into anterior mediastinum. So actually thymus is present here, but sometimes it may also extend into the anterior mediastinum. And next, right and left brachiocephalic veins and also SVC, that is superior vena cava upper half, are also present in the superior mediastinum. And the arch of aorta and its branches, so you can see this is the arch of aorta and its branches are also present in the superior mediastinum. And also we have the left subclavian artery, left common carotid artery, and we also have our brachiocephalic trunk, and we also have right and left phrenic nerve and also vagus nerve, azygous vein near opening into the SVC, left recurrent laryngeal nerve, and trachea, esophagus, thoracic duct. But remember that trachea, esophagus, thoracic duct are the vertical structures, and also we have the phrenic nerve. So you can see these are the vertical structures which are present in the superior mediastinum. And what are the contents of the inferior mediastinum? So the inferior mediastinum contains our thymus, mediastinal branch of internal thoracic artery, and also we have the sternopericardial ligaments. And next, coming to the contents of the middle mediastinum. So this is the middle mediastinum, right? So the middle mediastinum contains pericardium and heart, and we have the ascending aorta, and also we have a pulmonary trunk, pulmonary vein, trachea and its bifurcation, superior vena cava. We also have our phrenic nerve and also pericardiophenic vessels and also inferior vena cava. Next, coming to the contents of posterior mediastinum. So posterior mediastinum is nothing but this one. So what there are? Mnemonic is by dates VP and also hemizygous vein. So dates VP and hemizygous, that is dates VPH. So mnemonic descending thoracic aorta, azygous system of veins, thoracic duct, esophagus, sympathetic chains, planktonic nerves, vagus nerve, posterior intercostal nodes and also vessels. So what are the So what is esophagus actually? It is a muscular tube that is 25 centimeters and it has a cervical part near to the neck 4 centimeters, thoracic part in the thorax 20 centimeters, abdominal part near to the abdomen it is only 1 centimeter. So the vertebral extension is from the C6 to T11, that is the esophagus vertebral extension is C6 from cervical part C6 to thoracic T11. And the constriction of the esophagus and the distance from the incisor teeth is important. So at the C6 we have constriction at the cricopharyngeal junction, that is 6 inches from our incisor teeth, and the T4 that is crossing of the arch of aorta, it is the ninth in the ninth part, and it is 9 inches from our incisor teeth, and T6 it is crossing the left bronchus at the 11th and it is 11 inches from incisor teeth, and T10 is a esophageal opening in the diaphragm 15 inches from our incisor teeth. So let us say blood supply of the esophagus. So the blood supply, we have arterial supply and venous drainage. So first in the cervical part of the esophagus, that is if you remember it is 4 centimeters. So the 4 centimeters cervical part is supplied by the arterial supply, that is the inferior thyroid artery, and the venous drainage into the inferior thyroid vein. So inferior thyroid artery, inferior thyroid vein into the cervical part. And the thoracic part is 20 centimeters and it is arterial supplied by bronchial artery, that is the branch from the descending thoracic aorta, and the venous drainage into the azygous system of veins. And the abdominal part we are having the left gastric artery, that is the branch from the celiac trunk, so it drains into the left gastric vein, that is branch giving in turn draining into portal vein, and also azygous system of veins which are draining into the caval system. So we can say it is a portocaval system. So the portocaval anastomosis meeting point of the left gastric vein and the lower esophageal vein. So the largest lymphatic vessel in the body is the thoracic duct. So the beaded appearance is seen in the numerous walls because drains the entire part of the body except. So the beaded appearance is because of the numerous valves present in it, and it drains the entire part of the body except, that is the right head and neck, the right upper limb, and the right thoracic wall, right lung, right side of heart, and also convex surface of slipid. Only all right side structures are not supplied by thoracic duct, except that all parts are entirely drained by a thoracic duct. So let us see the course. It arises from the cisterna chyli location, especially L1, L2. It is highly variable because of its location is highly variable. We can't find. It may be around L1 or L2. We can't say fixedly it is in L1 or L2. And it is a dilated lymphatic sac and passing through the aortic orifice in the diaphragm at the level of T12. And it ascends to the posterior mediastinum, and at T5 it crosses from right side to left side. And at C7 drains at the angle of left internal jugular vein and also left subclavian vein. So let us see the tributaries of thoracic duct. The tributaries are bilateral ascending lumbar lymphatic vessels, bilateral lower 6 intercostal lymphatic vessels, left upper 6 intercostal lymphatic vessels, left subclavian lymphatic vessel, left jugular lymphatic vessel, and also left bronchomediastinal lymphatic vessels. So now let us see the azygous system of veins. So azygous system of veins connect both inferior vena cava and superior vena cava. It is in the paravertebral position and the components are azygous vein, hemiazygous vein, and also accessory hemizygous vein. So the formation of azygous vein is by the right lumbar azygous, that is arises from the back of inferior vena cava, may be absent in few. And the right ascending lumbar is anastomosis with the lumbar vein and the right subcostal vein, and the mode of formation of azygous and hemiazygous vein is highly variable. In those with absent the right lumbar azygous, and the azygous vein is nothing but the right ascending lumbar plus right subcostal. So if it is absent, then right subcostal plus right ascending lumbar together form the azygous vein. Next, the tributaries of azygous vein. The tributaries are right superior intercostal vein which drains into arch of azygous. It is formed by 2nd, 3rd, 4th posterior intercostal veins, 5th to 11th right posterior intercostal veins, right mediastinal veins, right esophageal veins, right bronchial veins, that is the last tributary, accessory hemizygous vein, that is T7, and also accessory hemizygous vein, that is T8. So this is about mediastinum, and now let us see the tributaries of accessory hemizygous vein. So that is 9 to 11th left posterior intercostal vein, left esophageal vein, left mediastinal vein. And the note that the left superior intercostal vein formed by the 2, 3, 4 posterior intercostal vein drains into the left brachiocephalic vein, whereas on right side it drains into the azygous vein. So the lower part of the esophagus is the site of the portocaval anastomosis, and the sternal angle is present between the T4 and also upper half of T5 in majority of adults, and the sternal plane marks the site where SVC opens pericardium and enter the right atrium. Now let us see the posterior mediastinum. So the posterior mediastinum, anteriorly we have tracheal bifurcation, pericardium and also pulmonary vessels. And posteriorly we have the bodies of T5 to T12 vertebra. And anterior inferiorly by arched posterior 1/3 of central position of diaphragm. And the lower border of posterior mediastinum extends quite inferior as compared to the anterior mediastinum. And the right recurrent laryngeal nerve don't pass by the superior thoracic aperture. It hooks around the right subclavian artery in the neck region and ascends up in the tracheoesophageal groove to supply the larynx. And the left recurrent laryngeal nerve passes by the superior thoracic aperture. And the left common carotid artery passes by the thoracic aperture to enter the neck region, where it bifurcates into the external and internal carotid arteries. And the sympathetic trunk begins at the foramen magnum, passes through thoracic aperture to reach the thorax and opening in the diaphragm to reach the abdomen, and also terminates in front of the coccyx. And next, the thoracic duct begins at the upper end of cisterna chyli in the abdomen and passes posterior to the diaphragm, reach the thorax, then pass by thoracic aperture and enters the neck, where it terminates in the neck veins. And superior vena cava pierces the pericardium opposite to the second costal cartilage at the angle of Lewis and the level of T4 to T5. Intervertebral disc also receives azygous vein about 2 centimeters below the sternal plane at level of T5 vertebra and enters the right atrium at the level of fourth intercostal space. So angle of Lewis is formed by manubrosternal joint at the level of second costal cartilage, that is anteriorly. And the plane joining the sternal angle to the intervertebral disc at the T4 and T5 called the sternal plane. And the thoracic duct receives the limb from both halves of the body below the diaphragm and only left half of head and neck and upper limb and thorax. So the right bronchomediastinal trunk drains the right lymphatic duct. And the chylothorax, what is this? The accumulation of lymphatic fluid in the pleural cavity depending on the obstruction is above or below level of fifth thoracic vertebra of the pleural effusion. It is either right or left sided respectively. So these are some of the important points from the bits. So by this we complete our mediastinum. Next we are going to discuss about diaphragm and phrenic nerve. Now let us talk about the last part of thorax, that is diaphragm and phrenic nerve. So in the diaphragm and phrenic nerve we have the development of diaphragm. So diaphragm is developed from cervical somites, mesentery around the esophagus and septum transversum, pleuroperitoneal membrane that so the defect, most common defect in the diaphragm is Box-Delx hernia. So the most common cause is congenital diaphragmatic hernia. So let us see the two types of hernia, that is Box-Delx hernia and Morgagni hernia differences. So the Box-Delx hernia is most common and most common site is on left side and due to the pleuroperitoneal membrane defect and its posterior lateral gap. And the Morgagni hernia, it is mnemonic is RAM, that is less common, most common site on right side and increase in the space of Larry. So space of Larry is nothing, that is space between the sternal and the costal origin of the diaphragm. So this results in an increase in the Morgagnian foramen and the hernia occur. So the retrosternal anterior medial gap is behind the sternum. So this RAM means R means on right side, A means anterior medial side. So this is mnemonic for Morgagni hernia. But the most common hernia is the Bock-Leden's hernia. Now let us see the orifices of diaphragm. So T8, T10 and T12 are the orifices of the diaphragm. T12 is present in the crus and the mnemonic is IOA. So I IVC opening, O esophageal opening and A is the aortic opening. So T8 IVC opening, it is present in the central tendon of our diaphragm and it is derived from the septum transversum and it has the right phrenic nerve and its undivided lateral mesoderm, septum transversum means. And the muscular part T10, that is esophageal opening, has the esophagus, right vagus nerve, left vagus nerve, esophageal branch of left gastric artery and its branches. And next we have the aortic opening where we have the aorta, thoracic duct, azygous vein sometimes and also hemiazygous veins. So T12 is present in the crus. And next the nerve supply of diaphragm. So diaphragm is supplied by the phrenic nerve. The root value of phrenic nerve is C3, C4, C5 and C4 is the major branch. The dermatome for the tip of the shoulder, site of referred pain. So whenever we have the phrenic nerve deformity, the pain is referred to the lateral upper part of our arm get referred pain. And the course it passes anterior to scalenus anterior muscle in the neck and next enters the thorax by passing between the subclavian vein in front and subclavian artery behind. So the vein is in front and the artery is behind. And next in the thorax it crosses the internal thoracic artery from lateral to medial side and it passes anterior to the hilum of the lung and accompanied by the pericardiophrenic vessels. And the phrenic nerve on the right side is shorter because the right diaphragm is elevated by the liver. So phrenic nerve is actually a mixed nerve, that is it is having a motor and a sensory part. So the motor supplies the diaphragm and the sensory part supplies the pleura and the pericardium. So now next we have our from bits. So from bits we have some of the important points like blood supply of the diaphragm. So diaphragm is supplied by superior phrenic arteries, inferior phrenic arteries, musculophrenic arteries, pericardiophrenic arteries and lower 5 intercostal and subcostal arteries. So the right phrenic nerve passed by the central tendon either by the caval hiatus or just lateral to it. And next we have the left phrenic nerve. It passes by the muscular part of diaphragm, that is anterior to the central tendon and it is lateral. And next lateral to the left cardiac surface and more anterior than right phrenic nerve. And next the minor openings we have the space of Larry, that is the costoschiphoid gap, superior epigastric artery, and the medial arcuate ligament is the sympathetic chain, and the lateral arcuate ligament we have subcostal nerves and vessels. So note, the splanchnic nerves pass through right and left crusts of diaphragm and the azygous vein sometimes pass by right crust of diaphragm, hemizygous vein pass by the left crust of diaphragm. And the great splanchnic nerve pass by crusts but don't pass posterior to the crust of diaphragm. And aorta azygous thoracic duct lies posterior to diaphragm. Thoracic sympathetic trunk passes posterior to medial arcuate ligament or by diaphragmatic crust to become the lumbar sympathetic trunk. So by this we complete the total revision of thorax.